Hi, I'm going to be going over some OHI for case number 17, or aka Mr. Lee. So Mr. Lee does a really good job of keeping up with his oral hygiene. So he brushes 2 to 3 times a day, flosses, and keeps up with his 6-month routine perio checks. So he's a good patient. He comes in regularly. In the appointment, we noticed that he builds up a lot of calculus on the anteriors, and he just has some issues with like the lingual, so he doesn't clean as well. So he is using currently a combination of the horizontal and vertical brushing methods. So I recommended the modified Bass method. So you would be going either with a manual or an electric toothbrush. I gave suggestions of both depending on his preference. If you did a manual toothbrush, it would be a soft bristle, and then you would go at a 45-degree angle, brush a few strokes, and move along. And of course, the important areas to get was the calculus buildup on the lingual. So you would go at an angle and brush. And then again for the inside lingual surface, 45-degree angle to the gingiva. And then if you decided to go the electronic toothbrush route, then you would be doing the same thing, 45-degree angle. However, you would not scrub, just let it pulsate on its own. And same thing. And for the upper arch, the maxillary, he had some recession on 8 and 9, leaving some interproximal spaces, embouchure spaces. So I did recommend the electronic. That way he wouldn't be brushing away all the and cause more recession. So I think the electronic brushing method is a lot better for him. But that leads me to my next point. So Mr. Lee has some larger embouchure spaces on the maxillary anterior. So I would be using a tight or a medium and a proximal brush. You would wet the bristles first, and then you go in between the space, leaning more towards 1-2 surface, scrubbing a few times, making sure you do not hit the gingiva. You retract, clean off any debris with running water, and then go back in the same space, and then just lean towards the other 2 surface, clean away, wipe off any debris with running water, and then move on. And then Mr. Lee was also missing a few teeth, which was leaving his secondary molars just by themselves. So he's missing teeth number 3, 14, and 19. So whenever you have one tooth by itself like this, it causes a lot of bone loss because people don't really clean and the bone just wants to recede away since nothing's there. So I did recommend him using interproximal brushes or single tufted brushes. I like the interproximal brushes more because he does have a lot of recession on the anterior, so he can use them for both. That way he doesn't have to be buying a whole bunch of supplies. It's just more convenient for him. So for the teeth by themselves, I recommend either a medium or a large. That way he covers more surface. Again, wet the bristles first, then you lean up against the 2 surface, make sure you don't hit the gingiva, scrub away, and then run it under water. And then you can do the back if he feels comfortable, which I highly recommend. Scrub away, clean off any debris, and then you do it at an angle, and that'll just help him clean up a little bit more. And then I also recommended, he's currently taking lozenges, but they're the very acidic lemon lozenges and very sugary. So I recommended some TheraBresh lozenges that are less acidic and have xylitol in it. And then, but yeah, that is it for Mr. Lee. He does really well and keeps up with his hygiene, so it wasn't very hard to go for OHI. Thank you.